Fall sports practices are getting underway at the high school level. Football will be here in a couple of weeks, and other sports as well. So, high school athletes are returning to the competition to prepare for the upcoming school year. And then our Bronson Health Chat this morning, we're going to talk a little bit about preparing athletes for these seasonal sports. And Dr. Stacy Majoris is with Bronson Sports Medicine Specialist, a certified athletic trainer, and she's here to tell us more, give us some important information. Good morning.
Good morning, Ken.
Thank you so much for joining us. Well, it's been pretty warm of late, and athletes are out there training for the upcoming seasons. What can be done to make sure that heat-related problems don't crop up and affect their performance and their lives, in fact?
Yes, that's a very important topic at this time of the year. It's been a mild summer so far, but can always change at any second. So the best way to prevent illness, heat illness, or any other injury for that matter, is to really be prepared. And so we need to focus on not waiting until the symptoms arise, but rather preparing our athletes before they get into a situation where heat illness may be presented. I really suggest athletes to start hydrating weeks to days before their event or their practices. And on top of the fluid that they take every day, they really should be getting 6 to 8 ounces of water every 30 minutes that they're exercising. So that really means taking a break every 30 minutes, not just compounding those numbers on top of each other. And if they're going for more than an hour, you should consider some sort of electrolyte replacement with Gatorade or Pedialyte, something of that nature, so that the athletes can replace not just the water that they're losing. The other thing with prevention would be avoiding caffeine drinks such as energy drinks, coffee. Even our teenagers are drinking coffee, the 5-hour energy, all those sorts of things really need to be avoided. And certain medications. So if you have a chronic illness, there are athletes who have diabetes and other medical issues. So consulting with your physician is the best idea to coming up with a game plan so those medications don't necessarily cause even more dehydration.
Well, we've heard a lot in the news and recently about concussions. What should parents and coaches know about this subject? What should they be on the lookout for?
Definitely. Concussions are in the spotlight and have been for several years now. And the most important thing I can emphasize is education, education, education. Parents and coaches should really seek out education from reputable sources. We have a few here in Kalamazoo that are really, really good. Save Kids of Kalamazoo has a great website that has concussion information. We at Bronson, as well as several other area schools, have an extensive athletic training corporation, so they go out to the schools and educate. So if you're not really sure, you can always talk to your certified athletic trainer, and to make sure that you're up to date on all of the current information. So things change. Even 5 years ago, we weren't treating concussions the way we treat them now. And so you really need to make sure that you're up to date on all of the current information. But the most common signs and symptoms that you would notice from a concussion standpoint are the dizziness, the headaches, blurry vision, balance issues, and some not so obvious. If a coach notices a kid is not making his routes on the football field or they're missing assignments, that is more going to be alerted by the coach or other players versus that child themselves. And so if anyone ever suspects a concussion, they should really remove that child immediately from the field of play, have them evaluated by a medical professional who's up to date on their sports medicine criteria for concussions. And sometimes the child is not suffering from a concussion and can return. But if there's no professional on the sideline, either a certified athletic trainer or sports medicine physician, they really should seek care from an emergency room or their primary care doctor at their earliest convenience.
Dr. Stacy Majoris is with us from Bronson Sports Medicine Specialist. Is stretching important to prepare for athletic competition?
Kind of. So we've actually realized that stretching alone really doesn't provide much benefit when it comes to preventing injuries, but when it's paired with a very good warm-up, so you do a jog or a bike for 5 to 10 minutes, warm up the muscles, and then do a very good stretching routine, it can be helpful in preventing those injuries.
So now in the event that there is an injury, how do you make sure it's okay for your son or daughter to come back to competition?
That question really depends on the injury itself. So if an athlete has surgery, you really should follow the guidelines of the surgeon. They have a lot of tests that they run, things that the athlete needs to pass before they are cleared to play. If it's a general musculoskeletal disorder, sometimes it needs rehabilitation with a physical therapist or an athletic trainer. And for the most part, if they have good motion, full range of motion, and good strength of that body part, they can go back to play and sometimes need an assisted ankle brace or supportive device, but can feel comfortable competing. Concussions, though, are a whole nother battle, and that we do an extensive cognitive, which is including schoolwork and physical demands on the body to make sure that brain is healed. So following the advice of your medical professional is your best bet.
Well, we've shared a lot of information this morning, and Bronson has a special program on this topic coming up. Can you tell us more about that?
I sure can. Myself and Dr. Mark Seitzma, who is a fellowship-trained sports medicine orthopedic surgeon, and a certified athletic trainer, Laura Thomas, are going to be at the Bronson Athletic Club. This is a free program to all of Kalamazoo. We're focusing our discussions on the coaches and parents of athletes who are going to be competing not just this fall, but coming up in the winter and spring sports as well. You can register for this free program on bronsonhealth.com/classes, or you can call Bronson Health Answers at 269-341-7723.
Preparing our athletes for seasonal sports, our Bronson Health Chat topic this morning with Dr. Stacy Majoris from Bronson Sports Medicine Specialists. Thank you so much. Very important information as we get ready for another sports season coming up quickly for our high schoolers. Thank you so much.
Thank you, Ken.